great honor and pleasure to introduce Professor Hari Sharma. I'm absolutely sure that she needs no other introduction. He's a very well known personality in the field of neuroscience, and his work regarding CNS injury and repair is available all over the world, particularly regarding the role of nanoparticles and the function of both brain barrier. So I will kindly introduce his talk, CNS injury and repair, the role of nanomedicine, stem cells, antibodies, and other therapeutic agents.
Thank you, Gavin, for this introduction. And I was asked to present this topic, and I will try to do justice within 20 minutes. As I told you earlier, that this is a collective work, and I'm very happy that Swedish Strategic Research is also supporting our nanoparticle program. And obviously, the speaker is here, National Center of Toxicological Research, USFDA, and US Air Force Research Laboratory. This is my hospital. And of course, we are collaborating with Dr. Muresanu from Romania since 2006, and it is going to be wonderful. The nanoscience, after 2004, there is an explosion, and still I can tell that people are largely using nanomaterials in cell cultures, and in vivo studies using nanoparticles are still not very much available in the literature. So we wanted to focus few things, that these nanoparticles really influence brain function, but for that you have to use them in vivo, no other way. The second thing is that these nanoparticles can even modulate pharmacological action of any compound. So we just summarized this idea in a volume in 2009. And regarding the classification of nanoparticles, Bill Slicker has worked, and also US FDA and head office in Washington. Now there is definite guidelines about nanoparticles and its regulation, and much more is coming. So according to definition, any particle can be nanoparticles if it is less than 10,000 nanometers. And they are present everywhere, even in this room, and also outside, motor vehicle exhaust, and people are exposed to them. You cannot avoid nanoparticles. So the basic question is that what will happen if the intoxication level is much more increased than the normal situation? These are the questions. Then whether it can also influence disease modifying processes or the pharmacotherapy of drug treatment. And as you can see that this could be double-edged sword, because we use nanoparticles to enhance drug delivery, but this is still strange that none of the group is interested in studying the pathological aspect of nanoparticles that are used for drug delivery. And I am in the committee of European Nanomed that evaluates projects for funding, and still after 50 projects evaluated, none of the projects came that suggest that we must evaluate the toxicological aspect of those nanoparticles that are being used for drug delivery. But now European Union is regulating this very strictly. So it is our concern that, as I told you earlier, that neurorestoratology doesn't only mean traumatic injuries. There are many other kinds of disease that can kill human beings or affect their day-to-day life, and psychostimulants abuse is one of them, hyperthermia, and many more. But I will briefly describe some of these effects in a short time. I have pleasure to tell you we have Dr. Stephen Scapper here. He is Chief Editor of CNS Neurological Disorders and Drug Target. And he allowed us to do a special issue under hot topics of nanoparticles, nanoneurotoxicity, and nanoneuropharmacology. And I'm very very happy that Nobel laureate Dr. Shelley in physiology and medicine, he also believed that this is the right way to go, and also the 2004 Nobel laureate also thinks about that. Some of you might be knowing Dr. Ole Petter Ottersen. He was chief editor of neuroscience. Now he has become rector, so he relinquished his position. Still, he is very pioneer in neuroscience. So you can see that these great people are feeling that we are going in right direction. Now the point is that nanoparticles are used to enhance drug delivery. It's not a new thing. And for some of you not very familiar, I mean, there are many nanoparticles can be used for drug delivery. So a drug can be injected in nanoparticles and then they are administered, they will release the drug. Still we do not know how these nano delivery can enhance the effect of the drug. Whether it is reducing the catabolism of that particular drug, that could be one thing, or it is staying there for a long period, slow release, we need to work on. This is carbon nanofiber, and you can also inject some drugs here, and that can also be delivered. So there are various ways of this. And here is Xi'an from 2004, Nobel laureate. We had a good discussion on this aspect. The pioneer of nanowiring is Dr. Aruna Hari. He's from the University of Berkeley. And he discovered nanowiring of different metals, silica, silver, and titanium. And not only that, even stem cells can be nanowired and delivered. Well, this is not my specialty, but literature suggests that you can nanowire stem cells. They are much more effective, much more long-lasting, and can produce some good results. This is the quantum dot technology. You can also level drugs, and they can pass the membrane, releasing the drug, and stay there. While we are working also together with NCTR, and this is Dr. Xi'an. He works in the University of Arkansas, Fayetteville, and he's Dr. Wang, and they are very good friends. And he has this patent for nano paper of titanium. And this is a structure. One can use different kinds of titanium nanowire. We are using 20 to 40 nanometer in diameter. As I told you that these nanoparticles could be double-edged sword. So these nanoparticles or nanowires are used for drug delivery on one hand. On the other hand, if they are targeted specifically, they can even penetrate the cell units. And they can kill specific cells like tumor cells in this case. This is not my work, this is just taken from other work. You can see the lesion. And you can see that tumor degeneration within cell culture can be seen using nanowire, titanium-based nanowires. This is also carbon nanotube. As I told you, can be used for drug leveling. But what we are using, titanium nanowire, with the help of Dr. Xi'an from the University of Arkansas. And he told me that when he levels this drug, I do not understand this picture very well, but he thinks that the drug leveling is quite good. There are few questions we need to answer. That we should not believe that if we level any compound to nanowires, whatever it is doing good. That is one question. The second question is that, is there any time limit? For example, if we inject any drug nanowiring, it is working for always or all the time? But here is the question here. This is spinal cord injury, T9 and T12. We have used nanowired XYZ drug, not very concerned here. The idea is that after application of 5 minutes of spinal cord injury and 1 hour, you can see that there is still differences. So nanowired drug delivery is not a panacea for everything. It has specific pharmacotherapy. It also follows the biological rule. And these are controlled situations and these are untreated injury. This is what. The same thing we can see leakage of iodine, and you can see here 5 minutes and 1 hour. There are certain differences. and they are producing good results, but also the timing is important. This is the same case with Ivan's leakage. Then the second question comes, as I told you, if we have 4 drugs, for example, with different capacity of having neuroprotection, we nanowire all the drugs. Do we get very similar result irrespective of whatever the drugs we are using, or still we can see the difference? This slide shows the same thing. This is startled with scale, and rats can walk normally, so they have the 6th grade. Laminectomy can produce slight changes, not much. But spinal cord injury, the scale is very down. These are different drugs. This drug, we know that this is quite potent, and you can see that after 3 hours it produces much better results than the other drugs. So the answer is that nanowiring can enhance the capacity of the drug, but probably not change its pharmacological characteristics. The time course. The same thing were used at different time intervals after, and you can see that the drug that is doing good, it is always doing good. But even if we add, there is some effect of adding, but it not change the complete pharmacotherapy. So one should not understand that nano delivery of the drug can do anything and all drugs will become equal, whether they are good or bad. This is the analysis provided by the drug companies for which we have used the drug, and I do not understand in detail also, but there are 4 compartments, and you can see that untreated means most injured, and this is one drug leveled with nanowire. So they are here, means much more damage. This is the area that is most neuroprotection, and you can see that this drug is here in this compartment, whereas the other drugs were in between. So the point is that the differences will remain, but it potentiates. Electron microscopy here showed that this is untreated and this is nanowire treated. You can see that myelin is very well preserved and motor neurons are very near to the normal. So it means that they are doing something. I am not showing because of time the drug without nanowire for countries. So at this point we can say that although we understand that nanowiring has enhanced its effect, but we require more understanding. Nanotoxicity, and this is in vivo situation. We did some work, and 1 week treatment of silver nanoparticles, you can see there's leakage of the Ivan's tube, and it is quite deeper. So it has also the component of nanotoxicity. At the cellular level, we use here copper and silver, 2 identical size, 50 to 60 nanometers, because this is quite common that whether we use nanoparticles, silica, carbon, copper, anything of one size, probably it will have same effect. But here, this copper and silver produces albumin leakage. I mean, I'm showing only one example. You can see that the magnitude and intensity of albumin in 2 different cases in rat brain are different. Likewise, this astrocytic activation by GFAP. So by looking at this picture, one can still say that there could be differences in different types of nanoparticles. Then we go on to a study at electron microscopy. And what we can see here that copper, this is myelin vesiculation in normal cases, no injury is here. Silver, this myelin is much more vesiculated. It's the expression of heat shock protein and ultrastructural changes. So it produces changes that can also be visible at ultrastructural level. Now I have to come to the other part, the antibodies. And antibodies, we are using the idea that because of lack of time, I'm not going to those literature, but there are literatures that, for example, serotonin has 7 receptor and subtypes. If you want to block the action of serotonin, you could have multiple drugs. But if you use serotonin antiserum, probably it can bind to certain areas and block the action of serotonin in general. So there are good evidences that some cases hypothesis using a select antibodies of different neurodestructive agents. I will show you some results. Spinal cord injury, serotonin antibodies applied topically here. You can see that this is quite better than this spinal cord. It is untreated. And when there is neuroprotection, you can also see that leakage of iodine is less and edema is also less. So we can understand that probably serotonin is harmful agent. When allowed to increase after trauma, it produces adverse effects. Therefore, antibodies applied, here in this case over the traumatized spinal cord, can reduce within 5 hours. Then we also tried in another model of head injury. I mean, these are some classical pictures of description of head injury, no need to go on. And here I must mention that nowadays we have some discussion about cognitive impairment, and this is the latest report. There is no politics about that, but in Afghanistan, one of the US soldier has killed so many people, and the reason is that probably he was badly head injured, and therefore it is believed that when there is head injury, even after treatment, the mental function will change. These are just theories. And to this audience, I need not tell that the progression of brain injury induced changes will occur depending on the areas of the brain involved. For example, there are different kinds of injury affecting different regions, will have different effect. So, just to test our hypothesis, we have two different models of traumatic brain injury. One is head injury, where we apply this weight over here. It produces 0.2 to 4 Newton impact on it's closed head injury, no fracture. And then we compare with open injury, when this skull is open and making a lesion. These two injuries are entirely different. I don't have time to tell you. Then we applied serotonin antibodies in this model intracerebroventricularly, and I can tell you that the serotonin antibodies were neuroprotective. These neuronal cell changes were quite good. But here, when there is no fracture, if you apply injury on right side, the left side is much more damaged. Probably this is a model of contrast. Here is an example of open brain injury. This is the lesion. You can see here, within 5 hours, we apply antibodies to nitric oxide synthase, and you see by yourself that this leakage brain is quite wet. There are some questions. If you apply antibodies over the brain or the spinal cord, does it penetrate? Or does it able to stop its antigen in vivo situation? The point is very clear here that this is the picture from the spinal cord, nitric oxide synthase upregulation, and after application of the antibody, you can see that there is no NOS upregulation. You can say that they are the same antibodies applied, but I can say in this way that no upregulation can be seen. One conclusion can be made from this observation that antibodies could penetrate. And there are evidences that within 10 minutes they can penetrate within the spinal cord. And these are different parameters that when the antibodies penetrate, they can also reduce other function. I have less time. Then we identified another neurodestructive agent is dynorphin. Dynorphin has different varieties, and since we are working in Uppsala University in Sweden, where large studies was there, obviously we have interest in dynorphin, and this is dynorphin A, 1 to 17. And you can see here this picture that when dynorphin is applied after spinal cord injury, this spinal cord is much better here. And we can also trace it at the evoked potential. I showed you here immediate loss of evoked potential, and here you can see that dynorphin antibody was able to stop this. So this is the electrophysiological signal, and these other parameters, morphological changes. Now, there are discussions about TNF-alpha and cytokines. There are two papers probably from Dr. Pan and Abakastin group that TNF-alpha might be neuroprotective, and this could be true. But majority of papers published showing that TNF-alpha has some neurodestructive properties. It was very difficult to look at this, so we used TNF alpha anti-serum. This is different, minus 30 minutes, 2 minutes, 5 minutes, 10 minutes. And then this is the application of TNF alpha. We have studied two things: motor neuron damage and upregulation of nitric oxide synthase, and of course changes in neuropathy. The point is that normally we believe that if we pre-treat or block before injury, it is always going to be better. So far this was true with serotonin antibodies, nitric oxide synthase antibodies, but here, if we prevent applying TNF alpha minus 30 minutes up to 10 minutes, we have adverse effects. But if we apply after 10 minutes and survival period is 5 hours, it has good effects. So the point is that even there are certain compounds or certain factors present in vivo situation, their presence is required before injury. If we block them before injury, it could have adverse effects. This is just what we have started, and it's very preliminary. I don't want to go into detail, where we have applied some stem cells, nanowire, and you can see that these nanowire has capacity to just mildly penetrate across the cell and without harming them. And we have a model of diabetes, and we try to see how it works. And nowadays, it is quite clear that cognitive functions are affected, especially in hippocampus. We have previous papers, and in diabetes. This is the example that the stem cells can grow even on nanowires. They're quite good. And these are the examples. I don't understand that. This is a protocol for some that nanodrug delivery can be better, process blood-brain barrier much better. So this is the model. These are our nanowires, titanium nanowires, and any drug can be labeled. This is the work of Dr. Xi'an from University of Arkansas. And we tried this in combination, that diabetes aggravates neurotoxicity, nanoparticle, it affects in spinal cord injury. I will not show all the results. Then we also tried, how many minutes I have? Okay. Then we also tried to reduce this neurotoxicity by diabetes. The model is steroidosine, and even we have used methamphetamine after that. These are only experimental situations, and then we have nanowire, different drugs, and also stem cells. What you can see that if you apply nanowire BDNF and GDNF, the glucose level were not affected. But you can see that leakage of iodine here in this case is really influenced by nanowire than the parent compounds after methamphetamine. And here they are working much better. These are the nanowires, these are the normal compounds, and it's brain water. And these are the changes in sodium and potassium electrolytes. And the point is that sodium also always increases when there is brain edema, potassium decreases, and sometimes chloride do not change. But the nanowire drug was most efficient in regulating the water level. And here is the distorted neurons, and you can see here that nanowire were the most effective. And just closing this talk. And here is the combination of methamphetamine and diabetes. Here you can see that neurons were almost much more degenerated, and here is methamphetamine alone. And then this is the effect of nanowire BDNF 60 minutes after diabetes, and BDNF alone, and see here. I'm not going in detail about hypothermia because of lack of time. But these are the stem cells were prepared. I have not done by myself, but they say that it is quite pure. And then they were nanowired here and delivered. And this is the hypothermia-induced pathology in diabetes. You can see that nanowired were much better preserved than stem cells alone. It's very preliminary study. And also in hypothermia here with diabetes, and the stem cell alone and nanowired stem cell is much better in preventing. These are acute experiments of 4 hours. And these are some only graphical representation that each stress is here, diabetes is here, and always nanowired drug is helping much better. There are only 3 slides about this, about blood-brain barrier permeability is most effective. So we can only summarize that nanowired drugs are effective. Nanowired stem cell delivery is better than alone, but we have to go much more ahead or find out what is the real mechanism. But we believe that future is bright. And this nanowire was supported by former Education Minister of Sweden, Thomas Östros, and of course we have some connection from India, and these are our supporters. Thank you very much for your time and attention.
Thank you so much.